Good evening, everybody. Myself, Dr. Avisek Mukherjee. Today, I'll be speaking about hypertension. Now, today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessels. This is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess fat builds in their arteries. Second is family history of high blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty food increases the fats throughout the body and makes the heart work harder to push through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further rise in blood pressure. Another one is stress. We are reacting to stress in unhealthy ways or not managing stress at all can also increase the blood pressure. Now, moving on. Hypertension does not have any obvious signs and symptoms. That is why it's called as a silent killer. It puts people's risk for several diseases from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether a person has high blood pressure or not. Now, generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called a sphygmomanometer. Our blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or a normal blood pressure should be lower than 120 by 80 millimeters of mercury, or it can also be read as 120 over 80 millimeters of mercury. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates a diastolic blood pressure, means the pressure in the blood vessels when the heart rests between these. If blood pressure is more than 140 by 90, then the patient is said to have hypertension. If person's blood pressure levels are higher than this, he or she might be at risk of developing serious heart diseases. This risk can be prevented by taking a few steps towards a healthier lifestyle, such as regular exercise, healthy diet, quitting of smoking, reducing alcohol intake, regular blood pressure monitoring, stress management, and adherence to their medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid delay or reduce the need for medication. Now, so let's look at these strategies one by one. First of all, regular exercise or physical activity. Exercise can be a drug free approach to lowering blood pressure. Regular physical exercise and activity makes a person's heart stronger. If one has a strong and healthy heart, it can pump more blood vessels and with lesser effort. So, if the heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In other case, if we are all aware that age and weight gain are the two major risk factors for high blood pressure, Now, if the blood pressure is at a desirable level, that is less than 120 by 80 millimeters of mercury, then exercise can help prevent it from rising as we age longer. Regular exercise also helps us maintain a healthy weight, which is, in my opinion, an important way to control BP. One should aim for at least 30 minutes of aerobic activity most days of the week. High blood pressure can reduce it by doing regular, structured exercises such as brisk walking, jogging, swimming, cycling, etc. Coming to the diet, it plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as a DASH diet or a Mediterranean diet by eating less saturated fat or total fat, getting plenty of potassium, limiting the amount of sodium in their diet, and limiting the alcohol consumption. What does DASH diet stands for? DASH stands for Dietary Approaches to Stop Hypertension Diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and skimping on the natural fat and cholesterol can lower one's blood pressure by up to 11 millimeters of mercury if having high blood pressure levels. Similarly, reducing sodium in our diet, even a small amount, can improve the heart health and reduce blood pressure by around 5 to 6 millimeters of mercury if someone has a high blood pressure. So, when we take or buy food, we should read the food labels. If possible, choose low sodium alternatives of the foods and beverages that we normally buy. We should eat fewer processed foods, like only a small amount of sodium occurs naturally in foods. Most of this sodium is added during processing. So if we eat natural products, this doesn't have that added salt. Coming to the regular salt intake, one level teaspoon of salt has around 2300 milligrams of sodium, which is a very high amount. So we should avoid adding salt to our food. We should use either herbs or spices to flavor our food. Coming to smoking, stopping of smoking helps our blood pressure return to normal. Quitting smoking can effectively reduce our risk of heart disease and improve our overall health. Now, blood pressure monitoring is very important. Some of the hypertensive patients check their blood pressure by visiting their doctors, but it is not always possible for all and every one of them to visit doctors and check up their blood pressures regularly. Hence, most often I advise my patients for self monitoring of their blood pressure levels. Self monitoring helps the person to measure blood pressure at different times throughout the day and over a longer period of time. It also assists doctors to get a more complete picture of the patient's blood pressure readings at different times of the day. Further, it helps us better predict the cardiovascular morbidity and mortality rather than a single routine blood pressure measurement during a clinical visit. Now, coming to the stress management, by learning how to relax, manage the stress, and can improve emotional and physical health by lowering the blood pressure levels. There are different techniques include exercising, listening to music, focusing on something calm or peaceful, or meditating, which can reduce our stress. Finally, coming to adherence to medicine. A medicine to lower blood pressure can be recommended by the doctor. If your blood pressure is consistently high, usually at or above 140 by 90, adherence to medicine is very important as it controls your blood pressure regularly and throughout the day. At last, I would like to suggest that if there is anything more precious than having a fit and a healthy life, adapting a healthy lifestyle can help us by enjoying a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you so much. Bye bye.